The co-discovery workshop, more specifically, is focused on how to help your patients make better decisions. So in the simplest way to kind of think about this is, in dentistry, we have kind of two different choice situations. One I would call simple decisions, simple circumstances. Hey, you got a hole in your tooth. That hole needs to be fixed. Simple. You don't need a deep relationship to understand that unless there's a big pattern of that and they've got a more systemic problem. It's a basic, it's just a basic transaction, basically. So some, admittedly, some patients in your practice need very little clinical dentistry. They're good at taking care of themselves, and their need for repairs is little to none. That's not a person that you need a deeper relationship with to be effective. Now, on the other hand, you have the 50-year-old or the 60-year-old that comes in your office that had a lifetime of just kind of urgency-driven dentistry, repairs everywhere, failing stuff everywhere, maybe an occlusion that's been worn down, so they've lost vertical dimension, their posterior teeth are getting destroyed because their anterior guidance has been destroyed. They've got all kinds of system problems. They might show up to your door with a broken tooth. They might think that all they need is a filling, but what they really need is a comprehensive evaluation of the situation, because it's not just about a lost or filling or a broken tooth. That's a complex situation that requires a much more sophisticated relationship for you to be successful, to make them, to facilitate them in making a better choice for themselves over long term. If this person is somebody that values their teeth long term, then it is time for a discussion about the way things are trending and what's going to happen if some of these issues aren't addressed. So that's where co-discovery fits into the picture. You can't just dump all this information on a stranger, essentially. And historically in dentistry, that's what we were kind of trained to do: bring them in, take the appropriate x-rays, do the examination, create a list of all the things that are wrong, tell them about it, give them a price, and then try to negotiate out when they're going to do it. And, we all experience tremendous amount of failure at that. I think I heard somebody say that the, comprehensive case acceptance rate isn't a whole lot higher than maybe 30% in some of the even the better practices. And I would argue that probably the main reason that happens is that people haven't spent the time to develop the relationship with the patient first, so that information doesn't hit them like a wall and trigger their neurobiology to just run or freeze, right?
Right.
So the key to it is to develop a optimal learning environment so that they can get the information at a pace that they can understand it, assimilate it, process what that means to them, get some vision for what they want to see long term. This kind of ties into my little hiring narrative thing. Try to create a narrative in their mind, a vision in their mind of what they want to experience going forward in the future, a future focusing, and then develop a treatment strategy that's based on that. That's where the motivation to proceed comes from. It doesn't come from me being a good salesperson. It comes from me facilitating in them a vision for something that they want and desire and are willing to pay the price to receive: time, energy, and money.